Public services in Wales have faced significant financial challenges since 2011. The amount of funding available to the Welsh Government is determined through the Barnett formula. Between 2010-11 and 2014-15, the funding allocated to Wales has fallen by £1.2 billion. That's 7% of the budget. Back in 2011, the Welsh Government set out some indicative spending plans. These showed real-term cuts to spending on both health and local government. These are the biggest areas of spending. In practice, things have changed quite considerably. The Welsh Government has responded to pressures on the NHS by increasing funding for health above the initial indicative plans. As a result, funding for other areas, notably post-16 education and local government, has reduced more than initially planned. Since 2010-11, local government has prioritised spending on social care and schools, but the result is that spending on other non-protected areas has gone down substantially. And the pain is not over for Welsh public services. The UK government has announced further spending cuts to 2019-20. These take the total cut to Wales over the period of austerity to around £1.8 billion. That's 11% of the total spending on devolved public services.